in the LIMAC countries, lower and middle income countries of the world. Economic data have been very influential in the developed world, but frankly, as I'll explain to you in just the next 5 minutes, those data need to be produced elsewhere so that similar progress can be made. So I'll just give you some background about, this is a slide that I'm sure you can't read, but what it does is it arranges the countries of the world by the number of people with diabetes that they have. Actually, this is kind of old. This is from 3 years ago, but you can see that, you know, at the top are India and China. Those might be reversed now, and it goes down from there. And then in the blue lines are the amount of money that's spent for medical care of those patients. And immediately you can see that there's a very big line for the United States, even though it doesn't have nearly as many people as India and China. And if I can show it to you in a clearer way, this is expenditures for diabetes care in different regions of the world. So we have Europe, North America, South America, Southeast Asia, Western Pacific. And basically 90% of the money is spent for to care people in industrialized countries. But where 80% of the people are living, only 10% of the money is being spent. Just to show you how important this is for a person living in a lower middle income country, these are a few countries where the World Health Organization calculated the amount of money they had to spend out of pocket for essential medicines. You know, aspirins, ACE inhibitors, statins, blood pressure medicines, and insulin in various countries. And the way it's calculated is how many days of wages of the lowest paid government worker would it take to buy these essential medicines in different countries. So you can see in some countries like Bangladesh, where actually there are no data for insulin, but there's some subsidization of the price, maybe 2 days of wages. But in Nepal, 37 days of wages. And since there's only 30 days in the month, you can see that a person's not going to get these essential medicines. In India, another of our members, Ramachandran, did interviews with people with diabetes and discovered that among the poor, they spend about 27% of their family income just to buy insulin and other diabetes drugs. I'm sure that's the absolute limit of what they could possibly spend, because they're very poor, and this money has to go for food, clothing for their children, possibly paying for school fees. It's an impossible situation.